Hi, welcome back to my channel. In this video, we will talk about one-liner questions of larynx. Basically, we will just revise the most important points of larynx. So first of all, level of larynx is from C3 to C6. Then size is 44 mm in males and 36 mm in females. Now, total cartilages are 9 in number. So paired are 6 and unpaired are 3. Basically, there are 3, but basically there are 3 pairs. To remember the paired cartilages, you have to remember ACC. So basically, arytenoid, corniculate, and cuneiform. To remember the unpaired, you have to remember ETC. So we have epiglottis. T say we have thyroid cartilage, and from C you have cricoid cartilage. Alright, now angle of lamina of thyroid cartilage, it is 110 degree, 110 to 120 degree in females, and in males it is 90 degree. Now for hyaline cartilages, you just need to remember that all of them are elastic cartilages except these. So first of all, we have the thyroid cartilage, then we have basically for this first of all, just for this you just remember cat. All right, so from C we have cricoid cartilage, then a retinoid cartilage, that also basal part. All right, and from T you have to remember thyroid cartilage. Laryngeal joints, we have two laryngeal joints. So the first one is the cricothyroid joint, and second one is the cricoarytenoid joint. Both of them are synovial joints. Now here one thing you have to remember is that cricothyroid has T, so it allows transverse movement, and arytenoid allows vertical movement, like axis, okay, vertical axis movement along the vertical axis and movement along the transverse axis. Now for extrinsic ligaments, there are three you have to remember HTC. So we have hyoepiglottic ligament, then we have thyrohyoid membrane. All right, then from C we have cricotracheal ligament. All right, now in extrinsic you should know that we have only two. One is the quadrate membrane. All right, and then we have the cricothyroid membrane, also called as conus elasticus. Now in this you need to know in quadrate membrane specifically, basically you have two things. All right, one is the airy epiglottic fold and the vestibular fold. So in airy epiglottic, this is basically the upper membrane, okay, and it is from the retinoid to the epiglottis, and this is just give me a second. So this is the upper membrane and lower part is the vestibular fold. All right, then rima glottidis versus rima vestibuli. So rima glottidis is the space between two vocal cords. Space between two vocal cords is glottidis, and space between two vocal folds. So V for vocal and V for vocal folds and V for vestibuli. So this is vestibuli. Now tuning fork is cricothyroid. Shape of posterior cricoarytenoid is triangular. One unpaired muscle is transverse arytenoid. Then next is elevation of larynx. Now for elevation of larynx we have thyrohyoid and mylohyoid. So for depression, just remember both are sterno only. So sternothyroid and sternohyoid. Okay, opening upper part, so thyroepiglottic. Epiglottic. Then closing airy epiglottic. In abductor, you have to remember posterior cricoarytenoid. This is asked a lot of times. For adductor, you have to remember lot. So lateral cricoarytenoid. Then oblique arytenoid and transverse arytenoid. Tensor of vocal cords and modulation of voice. So this is, as I told you before, also tuning fork. So same functions of cricothyroid muscle. Then relaxer of vocal cords. This is vocalis and thyroarytenoid. Now this is also the modulator of larynx. Now blood supply. Blood supply, nerve supply. Basically, it's easy. See, these are our vocal cords. Okay. Now above them superior laryngeal artery, in and below them inferior laryngeal artery. Then vocal cords के ऊपर sensory supply through internal laryngeal nerve and नीचे by recurrent laryngeal nerve. Okay, just remember this much. Then motor supply. All muscles are supplied by motor supply. All muscles by recurrent laryngeal nerve except cricothyroid, which is supplied by the superior laryngeal nerve of vagus nerve. Okay, laryngeal branch. Then shapes of rima glottitis. So this is very important. So first of all, shape of rima glottitis in quiet breathing. So to know it very easily, you have to think of three things. Okay, so in quiet breathing, you have to remember it is pentagonal. Okay. Now if you are forcing something, you are pressurizing, so diamonds, right? So diamonds are built under pressure, so diamond shape. Then for phonation and speech, like normal only it is happening. Normal curve is usually linear, so linear chink. Then whispering. In whispering, you have to remember funnel shape. Okay, basically how you whisper with your hands like this, so funnel shape. All right. Also in this, one more question they ask is which muscle is involved. So which muscle is involved is lateral, like muscle of whispering, as a question they ask. So lateral cricoarytenoid. Now in saccule of larynx. Now this is the anterior part of the just give me a second. So saccule of larynx, this is the anterior part of sinus of larynx. All right, this basically extends, it's too much orange, so basically it extends upward as diverticulum between vestibular fold and lamina of thyroid cartilage. Now oil can of larynx is basically the saccule only. Why is it called? Because the mucus glands are present for lubrication. Now epithelial lining of larynx. All the mucous membrane of larynx is by the ciliated columnar except three parts, which is the anterior or the lingual surface, vocal cords and upper border. All of this is by stratified squamous. All right. Then parts of rima glottitis, two parts. One is the intermembranous and intercartilaginous. Okay, so intermembranous is between vocal cords and intercartilaginous is between the vocal process of arytenoid cartilage. Okay, now injury to the internal laryngeal nerve. So first of all, internal laryngeal, first is external. So external laryngeal nerve. So external laryngeal nerve supplies the cricothyroid, right? So I told you here, so in cricothyroid, so if it is supplying the cricothyroid, right, so this is external laryngeal nerve only. So cricothyroid, right, cricothyroid was the ear tuning fork. So basically weakness in phonation. All right, so then 35th is injury to unilateral recurrent laryngeal nerve. So very characteristic hoarseness of voice. If bilateral, we will have stridor. Okay, and vocal cords will acquire, basically I'll just shorten it, vocal cords will be in paramedian position. Then internal laryngeal nerve, anesthesia of larynx. Now this is important if both ELN and SLN, RLN are affected. So basically what will happen is the vocal cords, they will be abducted and fixed, plus there will be paralysis of intrinsic muscle. So what will happen is cadaveric position, then loss of timbre of voice. I think timbre is quality of voice. All right, so and there will be monotonous voice. So these are the very very important one liners, and mostly it is all of the part of the larynx that you should know. So in this video I tried to cover most of it, and it has been covered. So if you like the video, do subscribe to my channel. Thanks.